pain in the chest, coffee and chocolate, fundoplication surgeries with the upper part of the stomach over the lower part of the esophagus. Obesity, pregnancy may be herniated from abdominal cavity to the chest, the thoracal area. Hello, this is Dr. Abdullah. I'm an upper GI surgeon and a bariatric surgeon. In my practice, I perform mostly bariatric surgery and also I perform upper GI surgical treatments. Today, we will speak about a serious problem, an uncomfortable problem, and it's called gastroesophageal reflux. And together with this subject, we will also speak about hiatal hernia problem. Both of these subjects are very associated with each other, so they have similar symptoms and the treatments are also similar. Let's go on. Gastroesophageal reflux is a condition in which the stomach acid flows back to the tube between the mouth and stomach called esophagus. This backwash causes some problems on the esophagus. There will be some inflammation and some irritation on the lower part of the esophagus. These are called esophagitis. In the long term, these esophagitis may cause Barrett esophagus, which is a disease of precancerous. The most common symptoms in gastroesophageal reflux disease are a burning sensation in the throat, which is called heartburn, pain in the chest, difficult swallowing is called dysphagia, and the backwash of some fluids, especially at night to the upside. There are some reasons for gastroesophageal reflux disease. The most common reasons are obesity, pregnancy, smoking, some foods, some spicy foods, and the time of nutrition. Actually, the patients who prefers to eat at night may have gastroesophageal reflux disease. In the treatment of reflux, the first thing that you should do is lifestyle change, because the most common reasons are associated with your lifestyle. Actually, changing the nutrition plans and the nutrition times are the most important things. And also, you should stop smoking if you are smoking, and you should be away from some foods and drinks like coffee and chocolate and some foods like onion. These all are the reasons that may cause gastroesophageal reflux. In the second option, the treatment of the gastroesophageal reflux includes the medical treatment. You should be prescribed acid-reducing medications. These are H2 receptor blockers and also proton pump inhibitors. These medications should be prescribed to you by a health professional. But we have some patients who has still symptoms even they have medical treatment. In this time, the option for treatment is surgical treatments. The surgical treatments of the gastroesophageal reflux disease includes some different techniques. The most common ones are called fundoplication surgeries, and the other surgical treatments are putting a device at the side of esophagogastric junction. It is called Link's device. These may be some treatment options. Fundoplication is a technique which surgeons use for treating gastroesophageal reflux disease. This surgery is performed by laparoscopy method. In laparoscopy method, the surgeon performs small incisions first and insufflates some gas in the abdominal cavity and inserts a camera. The surgeon focuses on the upper part of the stomach and lower part of the esophagus. First, it starts with the dissection of the hiatal area. The hiatal area is the part which the esophagus comes down through the diaphragm, and it's a hole. After the hiatal area, esophagus connects with stomach. In this part of the surgery, the hiatal area are dissected to see the enlargement of the hiatus, because one of the most common anatomical reasons for gastroesophageal reflux is the enlargement of the hiatus and herniation of the stomach to the chest through this hole. So after dissecting the hiatus, surgeon fixes that area with stitches. It brings a narrowing of the hiatus. After that, the upper part of the stomach will be prepared for fundoplication. Fundoplication itself is the part of the surgery in which the surgeon creates a wrap with the upper part of the stomach over the lower part of the esophagus. By this wrapping, the lower part of the esophagus is empowered and the acid reflux which goes up will stop. Following creating the fundoplication, surgeon controls the surgical area and surgery will end. This surgery takes around 1 hour. The results are really satisfactory. The patient selection is very important for fundoplication surgeries. If the patient doesn't benefit from medical treatment together with lifestyle change, he or she will be a candidate for fundoplication surgery. For the patients who are candidate for fundoplication surgery, the preoperative assessments are really important. First, all the patients should be performed an upper GI endoscopy. Actually, it's better to be performed by the surgeon who will perform the surgery, who will perform the treatment. During the upper GI endoscopy, the surgeon will see the diameter of the hiatal area and will see if there is an inflammation in the lower part of the esophagus. In another name, it's esophagitis, and this will help for the surgeon to decide the treatment. We also need some more preparation together with upper GI endoscopy. It is called pH monitoring test. It's a test which shows the pH level in the lower part of the esophagus. Normally, the pH level of that part is more than 4. But in this test, if it is lower, it means that the stomach acid comes there and there is a serious acid reflux. This test can be performed via endoscopy also, and a tube will be located in the lower part of the stomach, and sometimes it can be a capsule. There are two different techniques. Both the tube and the capsule has a connection with a device, a cable connection or a Wi-Fi connection. By this connection, during 24 hours, that device measures the pH level of the patient lower esophagus. And the next day, the results will be evaluated and the diagnosis of the gastroesophageal reflux disease may be certain. According to the results of the endoscopy and pH monitoring test, the decision for the surgery will be made easily. Thanks to the laparoscopic application of the Nissen Fundoplication surgeries, the recovery process is really faster. In the first day, patients may start walking and may start drinking something in the 4th hour after surgery. and the next day, if everything is okay and the nutrition of the patient may start, after evaluating the nutrition, patient may leave the hospital. Following the surgery, we recommend our patients to take liquid diet for a few days in the beginning, in the adaptation period. After a few days, they will go on with soft food also for 3-4 days. After the first week, they may start eating solid food. And also the pain control following Nissen Fundoplication is better than most of the surgeries. There is no resection of any organ during this surgery, and this may be the reason for the less pain following Nissen Fundoplication. Actually, in the first 2 hours, patients may experience some pain due to the gas inside the abdominal cavity and maybe some nausea and vomiting because of the anesthesia medication. But after 3-4 hours, the pain and nose and vomiting control will be better. Hiatal hernia is a disease in which the reason is the enlargement of the hiatal area. Normally, the hiatal area is the part of the diaphragm muscle in which the esophagus and some other vessels goes down from chest to the abdominal cavity. But sometimes there will be an enlargement in that area, and actually the stomach and some other organs may be herniated from abdominal cavity to the chest, the thoracal area. And this may cause some different problems. The most common problem due to the hiatal hernia is gastroesophageal reflux. And according to the herniation of different organs, some more serious problems may occur. In the diagnosis of the hiatal hernia, endoscopy is important. Together with endoscopy, some radiological evaluations may be performed and diagnosis may be certain. After diagnosing the patient's hiatal hernia, we should focus on the symptoms. If there are some symptoms like gastroesophageal reflux disease, the acid reflux, heartburn, pain in the chest, the hiatal hernia should be treated. But if the patient is asymptomatic and the test doesn't show a serious hernia, the conservative treatment, the following of the patient may be another option. If the decision is treatment of the hiatal hernia, it means it needs a surgical treatment. For the treatment of the hiatal hernia disease, surgeons perform laparoscopy method. And in the laparoscopy, 3 to 4 small incisions may be performed. After insufflation of some gas in the abdominal cavity, a camera may be inserted and the hiatal area will be dissected. After dissecting that area, surgeon fixes the defect over the diaphragm muscle called hiatus. After fixing it, also, if needed, a fundoplication may be added together because only fixing the hiatus may not solve the problem and the recurrence of the herniation may occur. Hiatal hernia surgeries are performed with laparoscopy method, and laparoscopy means a faster healing compared to the conservative open surgeries. And laparoscopy brings a faster healing, faster recovery. Following the surgery, after first 3-4 hours, patients may start walking and patients may start drinking something. And the next day, if the vital signs and laboratory tests are okay, patients may be discharged. Similar to the fundoplication surgeries, during the hiatal hernia surgery, patients may need a short-term and long-term nutrition plans. In the first week, we recommend liquid and soft food, and then they will go on with solid food. Finally, if you have symptoms of heartburn, if you have symptoms of serious chest pain, and if you have symptoms of coughing due to the acid reflux, and if you haven't benefited from medical treatment, you will be a candidate for surgical treatment. If experienced surgeons perform fundoplication surgeries and hiatal hernia surgeries, the results may be satisfactory. Thank you.